Okay, this presentation is going through the major joint actions that you're going to need to know for the gym instructor's course. Okay, so let's look at the different types of movements that you can do at synovial joints. So the first one we're going to look at is abduction, okay, abduction, and it's movement away from the midline or to abduct. Okay, so as you can see in the diagram, this guy is taking his arms away from his body, and so that joint movement is known as abduction. The opposite to abduction is adduction, and that's where you're bringing your arms in towards the midline or to add. And as you can see here, we've got a gentleman doing a lateral raise movement. So when he's lifting the weight up, he's taking the arms away from the body, so he's abducting the arms away, and then when he's bringing the dumbbells back down, he's adding the arms to the midline, so he'd be adducting. Okay, so now we're going to look into flexion and extension. So as you can see in the diagram at the top, flexion is to bend at a joint or to reduce the joint angle. So if we look at this guy here doing a bicep curl, when he's lifting the dumbbell up, he's bending his elbow, so he's flexing at the elbow joint. And the opposite of this is extension. Now extension is to straighten at a joint or to increase the angle, so for example from 90 degrees to 180 degrees. So in the diagram to the right, when the gentleman is lowering the dumbbell down, he's increasing the joint angle, so he's extending at the elbow joint. Okay, so flexion is when you reduce the joint angle, and extension is when you increase the joint angle. Okay, so now we've got some more joint movements. We've got supination, is when you rotate the forearm so that the palm faces forward or upwards. So you can think about supination as holding a bowl of soup, so your palms facing upwards, so that'll be a supinated movement. And pronation is rotating the forearm so that the palm faces backwards or downwards. Okay, so when your palm faces up, you're supinating, and when your palm faces down, you're pronating. Okay, some more joint movements for you. When you lift your arm in front of you, you're performing shoulder flexion. So anything that happens in the front of the body is flexion, and anything that happens behind the body is extension. So when you lift your arm in front of you, you're performing shoulder flexion, and when you're taking the arm behind you, you're performing shoulder extension. Okay, and if you had your arms out by your side and perform a circle movement, you're performing what is known as circumduction. Now going back to what I was saying before, so anything that happens in front of the body is flexion and behind the body is extension. If you lift your leg up in front of you, because the hip joint is moving, you're performing hip flexion. And then if you take the leg behind you, you're performing hip extension. So if we're looking at the diagram to the bottom right, we can see the gentleman's doing a very deep squat. So if we're looking at the hip joint, and I was going to ask you what is happening at the hip as he's going down, okay, you can see that he's reducing the joint angle as he's going down, so he's performing hip flexion. And then as he's standing up, he's opening the joint angle, so he's performing hip extension. Okay, and just to make sure that you're getting this, I'm going to ask you what is happening to the knees as he's squatting down, and hopefully you're seeing that the joint angle is reducing again, so he's performing knee flexion. And then as he's standing up, he's performing knee extension. Okay, alright, let's go on to the ankle joint. So whenever you plant your toes, you're performing what is known as plantar flexion. So that's when you point the foot away from the body. Okay, so think about pointing your toes, and that's plantar flexion. Now when you're pulling your toes towards you, towards your shin, you're performing what is known as dorsiflexion. So you're pulling the foot towards the body. Now, inversion is when you twist is a twisting movement of the foot inwards. So that's where the sole of the foot is facing inwards towards the midline of the body, whereas eversion is a twisting movement of the foot outwards. So think about going over onto your ankle and you're twisting inwards. That would be sort of an inversion joint action. Okay, now we're looking at the shoulder girdle. Okay, so the two movements here are depression and elevation. So anytime you're lifting the shoulders up, as if you're shrugging your shoulders, that joint movement is known as elevation. So think about a lift, and you're going up, you're elevating, you're going in an elevator. And depression is when you feel down. So when your shoulders are going down, that's depression. Okay, so elevation is when you lift the shoulders up, and depression is when the shoulders are going down. Now we're looking at horizontal flexion and horizontal extension. Okay, so think about a seated row. When your arms are shoulder height and your arms come in front of your body, okay, then that's it. The joint movement is known as horizontal flexion. And then if you take your arms behind your body, shoulder height, then that's horizontal flexion. And the important thing to note with this is that this happens whether you're in a standing position, or if you're laying in a supine position as is shown in these diagrams, or whether you're in a prone position when your you're facing the floor. Okay, so these guys, when they're performing a dumbbell shoulder press or dumbbell flies, because the arm is level with the shoulder and it's coming in front of the body, okay, so it's 90 degrees to the body, that is known as horizontal shoulder flexion. And you can see even more so in this dumbbell fly movement, okay, again, because the arm is level with the shoulder, the joint action here is horizontal flexion. And then when he's taking the arm back, if he was going to continue it back behind the body, that'll be horizontal shoulder extension. Okay, last couple. If you take your shoulders back, just by the definition, to take something back is to retract. Okay, so that joint movement is retraction. Okay, and then to hunch the shoulders forward, that is known as protraction. Okay, so retraction is when you're almost squeezing your shoulder blades together. Yes, if you squeeze your shoulder blades together, you're retracting. And then protracting is when you're hunching the shoulders forward. Okay, now lateral flexion and extension. So if this gentleman was standing upright, okay, leaning to this side, he's closing the joint angle here, okay, and moving sideways is known as moving laterally, and because he's closing the joint angle here, that's known as lateral flexion. And because he's stretching here, so he's increasing the joint angle, so this will be lateral extension, okay, and that's available in the spine. Okay, so I know that's quite a lot to take in, so just to check that you understand this, here are some diagrams, and I'm going to ask you what movements are happening in the following diagrams. Okay, so you have a lady that's doing step-ups, so I want you to tell me or write down what joint action you think is happening as the lady is stepping up at this point here, there. Okay, so what's happening in the left hip as she's standing up? Okay, and the way that I want you to write this down is that you would write the name of the joint, so in this case it would be the hip, and then what the joint movement would be. Okay, so it'll be hip something. Okay, so what joint movement is happening as this gentleman is lifting the weight up? Okay, so again you'd name the joint, so it would be the shoulder joint, and then say what the joint movement would be. So it would be shoulder something. Okay, so what is happening here as this guy is leaning forward? So what joint movement is happening at the hips as the guy is lowering the weight? So it'll be hip something. Okay, now what is happening to the spine as this person is coming up on the upward phase of an abdominal curl? So it'll be spine something. Okay, so what is happening at the elbow? What's happening at the elbow in the upward phase of this press up? Okay, next one. So what's happening at the shoulder as this guy is lifting the dumbbell up? Okay, so what joint movement's happening as the guy is lifting the dumbbell up? So it'll be shoulder something. And then what is happening at the toes as the guy is lifting the dumbbells up? Okay, so what's happening at the ankle as the guy's lifting the dumbbells up?